And if you would like one of our free audiobooks with NCLEX questions on ACX or Audible, the links are in the description below. Enjoy the questions.
Question 1. A 72-year-old female presents with dyspnea, pink frothy sputum, and bilateral crackles upon auscultation. Her vital signs are as follows: BP 160 over 98 mm of mercury, pulse 112, respirations 24 per minute, and SpO2 89% on room air. Which intervention should the nurse prioritize? A. Encourage the patient to lie flat and rest. B. Administer furosemide, Lasix, as prescribed. C. Increase fluid intake to prevent dehydration. D. Teach the patient pursed lip breathing techniques. Correct answer, B. Rationale: furosemide is a loop diuretic that helps to reduce fluid overload and pulmonary edema in heart failure patients. Options A and C would exacerbate fluid congestion. Option D may aid in breathing but does not address the fluid accumulation causing respiratory distress. Question 2. A 60-year-old male with a history of atrial fibrillation is prescribed warfarin, Coumadin. Which patient statement indicates a need for further teaching? A. I will limit my intake of leafy green vegetables. B. I need to have my INR levels checked regularly. C. I can take aspirin if I get a headache. D. I should wear a medical alert bracelet indicating I am on blood thinners. Correct answer, C. Rationale: aspirin increases the risk of bleeding when taken with warfarin due to its antiplatelet effects. Options A, B, and D are correct practices for patients on warfarin therapy. Question 3. A patient with a history of hypertension and diabetes reports new-onset chest pain radiating to the left arm and jaw. The nurse notes diaphoresis and pallor. What is the nurse's priority action? A. Administer nitroglycerin sublingually. B. Obtain a 12-lead ECG. C. Administer morphine for pain relief. D. Encourage deep breathing exercises. Correct answer, B. Rationale: obtaining a 12-lead ECG is the priority to determine if the patient is experiencing myocardial infarction. Nitroglycerin may be given after the diagnosis is confirmed. Morphine is secondary to addressing the primary concern of diagnosing the event. Deep breathing exercises are not appropriate during an acute cardiac event. Question 4. A 55-year-old male is admitted for heart failure. His BNP level is 600, and he is experiencing orthopnea and 3+ pitting edema. Which nursing intervention is most appropriate? A. Encourage fluid intake of at least 2 liters per day. B. Position the patient in a supine position to promote circulation. C. Administer prescribed diuretics and monitor daily weights. D. Restrict dietary sodium to prevent hypokalemia. Correct answer, C. Rationale: administering diuretics and monitoring daily weights are key interventions to manage fluid overload in heart failure. Options A and B would worsen fluid retention, and sodium restriction is intended to prevent fluid overload, not hypokalemia. Question 5. A patient with aortic stenosis reports dizziness and syncope during exertion. The nurse assesses a loud systolic murmur and diminished carotid pulses. Which is the priority nursing intervention? A. Administer nitroglycerin to relieve symptoms. B. Encourage ambulation to prevent clot formation. C. Ensure the patient remains on bed rest with head elevated. D. Educate the patient on low-sodium dietary options. Correct answer, C. Rationale: in aortic stenosis, maintaining bed rest reduces cardiac workload and prevents further syncope or hypotension. Nitroglycerin is contraindicated as it may significantly drop blood pressure. Ambulation would increase fall risk, and dietary education is not a priority during acute symptoms. Question 6. A patient with aortic aneurysm is experiencing sudden severe back pain and a drop in blood pressure from 130 over 80 mm of mercury to 90 over 60 mm of mercury. What is the nurse's priority action? A. Increase fluid intake to stabilize blood pressure. B. Place the patient in the prone position. C. Activate the rapid response team immediately. D. Encourage the patient to deep breathe and relax. Correct answer, C. Rationale: sudden back pain and hypotension indicate a possible rupture of the aneurysm, a medical emergency. Activating the rapid response team is crucial. Increasing fluids, positioning changes, or relaxation techniques are not appropriate in this emergency. Question 7. A patient receiving digoxin therapy for atrial fibrillation presents with nausea, visual disturbances, and confusion. Which laboratory result should the nurse prioritize? A. Potassium level. B. Sodium level. C. Hemoglobin level. D. Magnesium level. Correct answer, A. Rationale: digoxin toxicity is more likely to occur with hypokalemia. Nausea, visual disturbances, and confusion are hallmark symptoms of toxicity. Monitoring potassium is crucial in preventing and managing toxicity. Question 8. A 64-year-old male with a history of peripheral artery disease complains of leg pain while walking that is relieved by rest. What is the most appropriate nursing intervention? A. Instruct the patient to elevate his legs above heart level. B. Apply warm compresses to the affected area. C. Encourage the patient to walk until pain occurs, then rest and resume walking. D. Suggest wearing compression stockings during ambulation. Correct answer, C. Rationale: intermittent claudication is managed by graded walking to improve collateral circulation. Elevating legs, option A, and compression stockings, option D, would worsen symptoms, while warm compresses, option B, do not address the underlying issue. Question 9. A patient with congestive heart failure is prescribed spironolactone. Which dietary advice should the nurse provide? A. Increase potassium-rich foods to prevent hypokalemia. B. Avoid foods high in potassium such as bananas and oranges. C. Increase sodium intake to balance fluid levels. D. Avoid grapefruit juice as it interacts with the medication. Correct answer, B. Rationale: spironolactone is a potassium-sparing diuretic. Consuming high potassium foods increases the risk of hyperkalemia. Grapefruit juice does not interact with spironolactone. Question 10. A 78-year-old female patient is diagnosed with atrial fibrillation and started on diltiazem. What is the primary nursing assessment? A. Assess for signs of deep vein thrombosis. B. Monitor blood pressure and heart rate. C. Assess neurological status for stroke symptoms. D. Encourage a high-sodium diet to balance blood pressure. Correct answer, B. Rationale: diltiazem is a calcium channel blocker that can cause bradycardia and hypotension. Monitoring these parameters is essential. Stroke assessment is important but secondary to stabilizing heart rate and blood pressure. Question 11. A 68-year-old male with a history of myocardial infarction presents with new-onset shortness of breath, jugular vein distension, and 3+ pitting edema in his lower extremities. His blood pressure is 150/90, and heart rate is 110. What is the nurse's priority intervention? A. Administer IV fluids to improve perfusion. B. Elevate the patient's legs above heart level. C. Administer prescribed diuretics and monitor urine output. D. Encourage the patient to ambulate to prevent deep vein thrombosis. Correct answer, C. Rationale: these symptoms indicate fluid overload and possible congestive heart failure. Administering diuretics will help reduce fluid accumulation. Elevating legs and ambulation are contraindicated in severe fluid overload, and IV fluids would worsen the condition. Question 12. A patient diagnosed with acute myocardial infarction is receiving a nitroglycerin infusion. The nurse notes the patient's blood pressure drops from 140/85 to 90/60. What is the nurse's priority action? A. Increase the infusion rate. B. Notify the healthcare provider. C. Stop the infusion and monitor the patient. D. Place the patient in a supine position. Correct answer, C. Rationale: a significant drop in blood pressure suggests nitroglycerin-induced hypotension. Stopping the infusion allows for stabilization. Notifying the provider is important, but the immediate action is to halt the medication. Question 13. A patient with chronic atrial fibrillation is prescribed warfarin, Coumadin. During a routine clinic visit, the nurse notes bruising on the patient's arms and petechiae. What is the nurse's best action? A. Administer vitamin K immediately. B. Assess the patient's INR levels. C. Increase the patient's warfarin dosage. D. Encourage the patient to eat more green leafy vegetables. Correct answer, B. Rationale: bruising and petechiae suggest possible overanticoagulation. An INR assessment is required to determine the patient's coagulation status. Administering vitamin K is only indicated if INR is critically high. Question 14. A 72-year-old patient with peripheral artery disease reports pain and numbness in the legs when resting. The nurse observes the patient's legs are cool and pale. What is the most appropriate intervention? A. Elevate the legs to promote circulation. B. Apply ice packs to the affected areas. C. Keep the legs dependent to improve perfusion. D. Encourage increased fluid intake. Correct answer, C. Rationale: in PAD, keeping the legs in a dependent position promotes arterial blood flow. Elevating the legs would reduce perfusion further. Ice packs would cause vasoconstriction, worsening symptoms. Question 15. A patient receiving an ACE inhibitor for hypertension reports a persistent dry cough. What is the nurse's best response? A. This is a common side effect, I will notify the provider. B. You should stop taking your medication immediately. C. Increase your fluid intake to relieve the cough. D. Try taking the medication at night to avoid symptoms. Correct answer, A. Rationale: a dry cough is a common side effect of ACE inhibitors due to increased bradykinin levels. It should be reported to the provider for potential medication adjustment. Stopping the medication abruptly without provider guidance is unsafe. Question 16. A patient with a history of deep vein thrombosis is on heparin therapy. Which laboratory test should the nurse prioritize monitoring? A. Prothrombin time, PT. B. Platelet count. C. Partial thromboplastin time, PTT. D. Hemoglobin level. Correct answer, C. Rationale: PTT is the primary test to monitor the effectiveness and safety of heparin therapy. PT is monitored with warfarin, and platelet counts are secondary unless heparin-induced thrombocytopenia is suspected. Question 17. A 54-year-old male presents with a diagnosis of mitral valve prolapse. He reports palpitations and occasional dizziness. Which nursing intervention is most appropriate? A. Encourage high-sodium dietary intake. B. Administer beta blockers as prescribed. C. Position the patient flat to improve circulation. D. Teach the patient to perform the Valsalva maneuver during palpitations. Correct answer, B. Rationale: beta blockers help to reduce palpitations and prevent arrhythmias in patients with mitral valve prolapse. High sodium intake is contraindicated, and Valsalva maneuvers can worsen symptoms. Question 18. A patient with congestive heart failure is prescribed digoxin. The nurse notes that the patient's serum digoxin level is 2.8. Which symptom would the nurse expect? A. Bradycardia and visual disturbances. B. Tachycardia and flushing. C. Hypertension and headache. D. Hyperactivity and restlessness. Correct answer, A. Rationale: a digoxin level above 2.0 nanograms per milliliter suggests toxicity, often presenting with bradycardia and visual disturbances like yellow or green halos. Tachycardia and hyperactivity are not characteristic of digoxin toxicity. Question 19. A patient admitted for unstable angina reports chest pain despite being on continuous IV nitroglycerin. Vital signs are stable. What is the nurse's next best action? A. Increase the nitroglycerin infusion rate. B. Administer morphine as prescribed. C. Instruct the patient to perform deep breathing exercises. D. Apply warm compresses to the chest. Correct answer, B. Rationale: if nitroglycerin is not relieving chest pain, morphine can be used to alleviate discomfort and reduce myocardial oxygen demand. Increasing the infusion rate without provider approval is unsafe. Question 20. A 70-year-old female with a history of atrial fibrillation is started on dabigatran, Pradaxa. Which teaching point is most important for the nurse to emphasize? A. Avoid grapefruit juice while taking this medication. B. Do not crush or chew the medication. C. Increase intake of green leafy vegetables. D. Take the medication on an empty stomach. Correct answer, B. Rationale: dabigatran capsules should not be crushed or chewed as it may alter the absorption and efficacy of the drug. Grapefruit juice does not interact with dabigatran, and diet modifications are not required. Question 21. A 75-year-old male presents with severe shortness of breath, frothy sputum, and cyanosis. Auscultation reveals coarse crackles throughout both lung fields. His blood pressure is 180 over 110 millimeters of mercury, pulse 130, and SpO2 is 82% on room air. What is the nurse's priority intervention? A. Administer bronchodilators as prescribed. B. Position the patient in a high Fowler's position. C. Apply compression stockings to improve circulation. D. Encourage the patient to drink fluids to thin secretions. Correct answer, B. Rationale: high Fowler's position improves lung expansion and reduces pulmonary congestion in acute pulmonary edema. Bronchodilators are not the primary intervention for fluid overload. Compression stockings are irrelevant, and increasing fluid intake would exacerbate fluid overload. Question 22. A patient diagnosed with hypertensive crisis is receiving sodium nitroprusside IV. The nurse notes a sudden drop in blood pressure to 90 over 60. What is the nurse's immediate action? A. Increase the infusion rate. B. Stop the infusion and notify the provider. C. Place the patient in Trendelenburg position. D. Administer a beta blocker to stabilize blood pressure. Correct answer, B. Rationale: sodium nitroprusside can cause profound hypotension. The infusion should be stopped immediately to prevent further decline in blood pressure. Trendelenburg is not appropriate, and beta blockers are not used for this immediate reaction. Question 23. A 68-year-old female with a history of chronic heart failure is prescribed carvedilol. Which assessment finding would require the nurse to hold the medication and contact the healthcare provider? A. Heart rate of 58. B. Blood pressure of 138 over 88. C. Weight gain of 2 pounds in 2 days. D. Blood glucose level of 110. Correct answer, A. Rationale: carvedilol is a beta blocker that can cause bradycardia. A heart rate of 58 is a contraindication for administration. Weight gain is concerning but not an immediate reason to hold the medication. Question 24. A patient is receiving amiodarone therapy for atrial fibrillation. During a routine assessment, the nurse notes a productive cough, dyspnea, and abnormal lung sounds. What complication should the nurse suspect? A. Pulmonary fibrosis. B. Pleural effusion. C. Pneumothorax. D. Heart failure exacerbation. Correct answer, A. Rationale: amiodarone can cause pulmonary toxicity, including pulmonary fibrosis, which presents as a cough, dyspnea, and abnormal lung sounds. Pleural effusion and pneumothorax are not typical complications of this medication. Question 25. A patient with chronic venous insufficiency complains of darkened, thickened skin on the lower extremities and swelling that worsens throughout the day. What is the best nursing intervention? A. Apply warm compresses to the legs. B. Elevate the legs above heart level frequently. C. Encourage long periods of standing to improve circulation. D. Restrict fluid intake to reduce swelling. Correct answer, B. Rationale: elevating the legs promotes venous return and reduces swelling associated with chronic venous insufficiency. Warm compresses, prolonged standing, and fluid restriction are not appropriate interventions.